All right, well, for those of you I haven't met, my name is Amber Masso, and I am the Director of Communications and Alumni Engagement for the Terry Foundation. I'm so pleased to be joined by this excellent panel of alumni this evening, and I'm so excited to have a number of Terry scholars joining us from all across the country as well. I'm really looking forward to tonight's presentation. So just a reminder, we are recording this meeting. It is being conducted as a meeting rather than a webinar, so that you will have the opportunity to interact with the panel at the end. Feel free to ask questions in the chat or to make comments in the chat as the meeting goes on. I will be moderating the chat, so I'll either ask your question as the panel is discussing, or I'll save it until the end, just depending on what's going on at the time. And then at the end, people will have the opportunity to unmute themselves, turn their camera on if they have a question for the panel. So I'll help moderate that process as well. But I will let us go ahead and get started. So I'm going to turn everything over to our hosts this evening, Tiffany Rodriguez and Cody West.
Hi everyone, I am Tiffany Rodriguez, and Cody West and I, which we will take turns introducing ourselves, and then we'll talk a little bit about why we're here tonight. But first of all, we want to start with thanking everybody for taking this hour out of their day. My name is Tiffany Rodriguez, pronoun she, ella. I graduated from Texas State University in 2018, so that makes me a 2014 scholar. I just recently, 2 months ago, graduated from Boston University School of Public Health, where I earned my master's degree in biostatistics and epidemiology. And now I'm specifically working as a health equity associate at Boston Medical Center, where we work in a program that's national to help build community leadership capacity. And specifically, we work through a racial justice and trauma-informed lens. And then I'll pass it over to Cody.
Good evening, everyone. So my name is Cody West. I graduated from Texas State. That's actually where I met Tiffany at. The year I became a Terry Scholar was 2015. I can say that's the year that my life changed for the better. And I just recently graduated from the University of Houston Law Center. So I just got my law degree. And as of right now, I'm studying for the bar exam, but everything that's going on with coronavirus, I'm not sure if the bar exam is even going to happen this year, because the way the bar exam is historically taken is a group of recent law graduates. Some folks may not graduated that year, but a group of folks gather in a room and take a 2-day examination, but with restrictions on gatherings. I don't know if it's going to happen this year. So that's where I'm stuck at right now. Definitely not looking forward to having to wait to become a licensed attorney, but that's where we're at right now. So I'll pass it right back to Tiffany so she can explain a little bit more about the rationale why we decided to set this meeting up.
Thank you, Cody. So Cody and I have, like we said, we met at Texas State University, and we have been friends ever since then. And through the years, we've had continuous conversations about many things. But recently, Cody and I, after the murder of George Floyd, Breonna Taylor, and Black Lives Matter was really front and center in our communities, we came together and we started to talk about what is happening in our community, what roles do we have, and we shared our different viewpoints. And we decided on, not decided, but a common theme that came up was that we recognize that each one of us individually, doesn't matter what job you're doing, where you're at, we play a really important role in helping to shape our communities, and that there is not one solution to addressing racism in the United States. There's not one solution or one person that can knock down and fix white supremacy. There is not one person that can fix anything, but together, all of us individually, we can look around our communities, we can listen, and we can notice where's the problem, what's going on, and then we can think critically, we can think innovatively, we can team up with our community, and we can make changes that need to happen, because it starts local, it starts at home, it starts within your neighbors, and then it builds up. And that's how we see massive change that's needed in the United States. And one last thing is that we recognize that our Terry family was already doing a lot of this work. when Cody and I got together and with Amber to put together on this panel, this panel together, there was an exhaustive list, and it was hard for us to pick. So many Terrys are leading important work and changing their communities, and sometimes the spotlight isn't on the person, on us, the everyday people, but the work is always done by us, the everyday people. And so something that the Terry Foundation gave us is an education, and this we know has really helped us to show the skills that we already had inside of us. And it's really pushed us to have a certain level of power that we can use to return and invest back into our communities. And so I'm going to pass it over to Cody if he has anything other to add into that. And then we will pass it over to our incredible panel, which we are really excited to lift up the work that they are specifically doing in the fields of education, criminal justice, economic development, and education.
Yeah, Tiffany, I think you summarized everything well, so I don't want to take too long. I know the group of folks who came want to hear what these individuals have to say, so I'm going to pass it to Kayla to mention her Terry school and Terry year, and then also some of her background.
Hi, everyone. My name is Kayla Salazar, go by she, her pronouns, and I am a 2007 Terry Scholar that graduated from Texas A&M in 2011. Since then, I moved to Seattle to pursue a Master's of Social Work at the University of Washington and graduated in 2016. And ever since, I've been working at a local not-for-profit Medicaid and Medicare health plan that was founded by 20 of Washington State's federally qualified health centers or community health centers. For those of you familiar with community health centers, they really were founded on principles of social justice to serve underserved communities. And a lot of them were actually born out of the civil rights movement. That's really part of kind of what my organization is all about and really how my role has been developed. So currently I am the program manager of health equity, and my day-to-day looks like analyzing data to identify health disparities or those gaps in care that are results of differences, coming up with opportunities to address the disparities, educating our staff on equity awareness and how we need to be addressing racial injustice and every other kind of inequity that there is, and working with state partners to really understand how do we advance health equity in all aspects of healthcare. On a personal note, I now live in Austin, Texas with my husband, my baby, and my dog. And if you hear little noises in the background, it's probably my baby trying to go to bed.
Thanks a lot for the introduction, Kayla. Now we're going to switch over to Dr. Walker and let her introduce herself.
Hi, my name is Tammi Walker. I became a Terry Scholar in 1995. I graduated from Texas A&M in 1999. I am an associate professor of law and psychology at the University of Arizona, which means that I'm jointly appointed between the law school and the psychology department. So I'm originally from Bryan. So mission number one for me was to get the heck out of my hometown and to get the heck out of Texas, at least temporarily. So I went directly from Texas A&M to Columbia Law School. After that, I practiced law for a few years, and then I decided what I actually wanted to do was to get a Ph.D. So I have a Ph.D. in psychology from the University of Virginia. I'm a social developmental psychologist, and basically what I like to say is that I use my legal background as a means by which to generate research questions, and then psychology is how I go about trying to answer those questions, so like experiments and that sort of thing. And most recently, what I've been working on is studying is how universities adjudicate or handle sexual misconduct cases. So specifically what I do is try to use social psychological techniques in order to determine whether we can increase the number of people who are willing to participate in investigations at the university level by increasing the fairness involved in the overall process associated with investigating and trying to ultimately hold people accountable for sexual misconduct. That's a little bit about me, and I look forward to hearing your questions.
Thanks a lot for that, Dr. Walker. Now we're going to switch over to Mandy and allow her to introduce herself as well.
Okay, wonderful. Thank you so much, Cody. I just wanted to check and make sure my internet's still good because mine's breaking up a little bit.
You look perfect.
Okay, wonderful. Okay, wonderful. So my name is Mandy Price. I 1999 Terry from UT Austin. Graduated from UT Austin in 2003, then continued on, went to Harvard Law School, graduated there in 2006, practiced law, representing private equity firms for the next 12 years. And then during the course of that work, really became much more involved. I always did some work in diversity, equity, inclusion, even in college. serving on the Racial Respect and Fairness Task Force at UT Austin during my time there. But really started to become much more aware and much more passionate about diversity issues from a corporate lens. And so during my time working in various law firms, thought that the way law firms and organizations, corporate America overall, were approaching these issues were not really from a systemic lens at all. And there was no real discussion of equity. I think most organizations, especially in the corporate sphere, view themselves as a meritocracy, and that, you know, whoever is best is just kind of rises to the top. And so obviously when you look at the demographics of most organizations, we know that talent doesn't reside in just one race, religion, gender. And so we can tell there that there's some systemic and institutional equity issues going on. So decided to leave my law firm to really focus on this work. So 2 years ago, I founded Kanarys, which is a kind of really a data and analytics platform that helps companies measure equity and inclusion within their workplace. The initial reaction we get is, how do you measure equity and inclusion? That seems impossible. But I'm sure Kayla and others, and you know, all of us from the work we do, you have to actually look at your systems, your policies, your practices, look at things from an organizational perspective, and see what needs to be changed in order to ensure the systems are in fact equitable. So really excited about the work we've been doing, especially given, you know, over the past few weeks, I'm sure everyone's been seeing the companies that have made pledges to racial justice and are starting to work with those organizations on, let's not just make pledges externally for police accountability, which is obviously needed, but how do we work internally within our own systems to ensure that our corporate structures are equitable as well.
Thanks a lot for that, Mandy. Now, last but not least, Mr. Krystafer.
Hi, everyone. Krystafer Redden. I'm a Terry Scholar, 2008. And after my education at the University of Houston, I worked in the state legislature in Texas for a brief while, and then moved to Rhode Island to work in the public schools in Providence Public School Department here in the capital city of Rhode Island. I taught for 4 years and then moved into a district role. And then from that district role, I now work at the State Department of Ed in Rhode Island. If you're in Texas, the closest corollary would be like the Texas Education Agency in Texas. We're sort of the mediating force between the federal Department of Education and your local school district. And the work that I've done there over the past 4 years has really focused on trying to improve outcomes for our most underserved children and communities. Schools and districts very similar to the school that I worked in. Most recently, prior to COVID, I think the work that has been most illustrative of the hope and the conversation of this panel tonight was our governor a year ago appointed our first education commissioner for the state of Rhode Island, who was a woman of color. In her first year in the role, she decided to initiate a process of state takeover for the Providence Public School Department, which has had historically low performance levels for students for over 40 years. 1 in 10 students is able to read on grade level in Providence, and 2 in 10 are able to perform math on grade level. So we're talking about deep structural inequities. They're connected to lots of other inequities that I'm sure we're going to spend some time talking about this evening. But that work and the work of many people trying to improve outcomes for children and communities across the state is work that I've been engaged in over the past 8 years here in Rhode Island.
Thank you so much for sharing, Krystafer. So with that being said, we hope that you are all just as amazed by our panel as Cody and I are. Very proud to have everyone here tonight as well. We're going to kick it off with going to Kayla. Kayla, we're going to ask you 1 to 2 questions, and then we will take turns and pass it down the line where Cody will switch off. So Kayla, our first question for you, number 1, sometimes the public is unaware of how public health is a critical component of social justice and thriving equitable communities. Could you tell our audience tonight, what is public health and what role does public health play in building stronger communities?
Yeah, so the definition that I like the most about public health is that it promotes and protects the health of people in the communities where they live, work, and play. You might recognize those things as the social determinants of health. So it's really about health education, about prevention, and about understanding where and why illness occurs, and really thinking through those systemic issues of why illness occurs, more so in certain areas than other, and within certain populations more than others. So it's truly about, not just making healthy individuals, but making healthy communities. And as I mentioned earlier, many community health centers who have been doing the work of serving underserved areas were born out of the civil rights movement. And there's a reason for that, because health is vital to prosperity, and we cannot create strong communities without ensuring that everyone has the ability to be healthy, both, or I guess all mind, body, and soul. So again, it's not just about our physical health, but also our mental health and our overall well-being.
Thank you, Kayla. And I'm going to ask one more question. Could you tell us what health justice is? And once you've explained what health justice is, would you be able to explain where you think public health policy efforts really need to be kind of directed to better serve our historically underserved communities, specifically our Black and Brown communities in the United States?
Yeah, so there's a lot to unpack in the word justice. And I think the way that I like to describe health justice specifically is that it recognizes that healthcare is and should be a human right, a fundamental human right, and that everyone should have equal access to it, equitable access, I should say, that is also quality care. So we're thinking about quality, we're thinking about equity, and we're making sure that everyone has access to healthcare. As far as where to start in policy, that's such a tough question, but I definitely think it starts with funding. We need more money invested in the health of our communities. There is very little, and it's the first thing to get cut on many budgets across the nation and state budgets. So we need to protect the healthcare funding that is available and add to it and grow it. We also need to build infrastructure in the communities that have been underserved historically. If you look at a map of your own city, you'll probably notice that the hospital systems and big clinic systems are in nicer neighborhoods. They're not in historically underserved neighborhoods. We need to change that. We also need to think about how we're intersecting with other areas like education and criminal justice. All of those things intertwine, and so we need to be doing more work together, recognizing that we all play a role in the health of our communities. And we also need to be paying for the value of care instead of paying for how many things people do. So not how many procedures someone does, but how well their patients improve over time. We really need to rethink the way that we're paying for healthcare. And last, I'll just add that we need to be thinking upstream. So how do we create diversity in the healthcare workforce, starting by building facilities and places for people to work in the communities they live. And we need to be doing equity education at all levels of healthcare education, including med school and every other facet of healthcare.
Thank you, Kayla. You make my public health heart and mind so proud. I'm going to pass it over to Cody.
So Dr. Walker, I want to take this time to ask you about something that has been on the TV often in most of our homes with the recent killing of George Floyd. And as Tiffany mentioned, that was one of the reasons why we decided to have this panel discussion. So I want to ask you, what are some ways that we can ensure American citizens aren't killed, in the hands of police officers? And what are some ways that we can reform the criminal justice system at the local, state, and federal level? Because this is a much bigger issue than an isolated issue.
Oh, absolutely. Yeah, it's a good question. It's a good series of questions. I think we could spend basically an entire semester, if not an entire academic year, talking about it. And even though it's not necessarily my area of expertise, it is something that I've given a lot of thought to, primarily because my father was a police officer. He was a detective, and he was the first Black detective in Brazos County in Texas. He passed away a couple of years ago, but my experience, is not the same as a lot of people's when it comes to police, but yet I see what happened to George Floyd or to Eric Gardner or to Breonna Taylor. And you can't help but be horrified by the inhumanity of the reaction of the people at the time, but then also the responses that you see. Not just from the police, but from people who are in some way supportive of the police. So I think it's important to recognize that, these organizations aren't monolithic. They're not just one thing, but clearly there's an issue there, and we have to address what that issue is. I think the thing that comes to mind for me is with the current system, the way we think about holding people accountable is by asking the question of whether a reasonable person would have behaved in the same way that the police officer did. So if for example, in the case of George Floyd, would a reasonable person have felt like they needed to detain and put their knee on the neck of somebody like George Floyd, given the circumstances that we saw in that video? And I kind of feel like that's not the right question. And there's a number of reasons why I think that that's not the right question. But primarily because we have social psychological studies that suggest that even if you're looking at, if the average person is looking at a neutral face, if we're talking about Black faces, people tend to interpret that neutral face as an aggressive one, right? And so if what we're asking people to do, particularly like juries, to decide whether what something a police officer did is reasonable, people are far more likely to think, well, the police officer must have felt afraid, or I would have been scared, or I would have felt like my life was in danger when you're talking about Black people as opposed to any other person potentially. And so I think that that's a particular issue, but I think that that's not the only, or it's a place to start by focusing on how we hold the police accountable. But I don't think it's where we need to point or to make our focus, even in thinking about criminal justice generally. And I think that's because essentially, I think if we're focused on the point at which people have become police officers and they're members of the community who are there to serve and protect, that's almost too late. We have to remember that they are members of society, right? And that they had a whole lot of messages and teaching before they even got to the point where they became police officers. And I think it's, especially in some of the work that I've done, it's just not enough to say this is a police problem, because it isn't. It's a societal problem, right? Like, it's not just the fact that the police are arresting people and treating people in this really inhumane way. It's the fact that people are calling the police and saying that there's somebody is suspicious when they really mean basically that they're talking about a Black person, right? Or just the messages that people are taught by television or education that lead people to direct or to interpret innocuous behavior made by Black people in a way that is more negative, that leads to these negative outcomes. So while I think that focusing on police behavior is a start, I really don't think that that's needs to be the sum total of our focus. I really think it's a societal issue that we need to acknowledge the history of racism in this country and how we have all been socialized to think of each other in ways that don't allow us to look at each other as individuals in ways that is not immediately disparaging to our characters as opposed to the situation. And so, yeah, I mean, I would love it to say that I could come up with 3 different ways to solve things at the state, local, state, and national problem. But I think the first issue really is just to acknowledge that we do have a problem. And I don't even think that we're there yet.
Right. Definitely. I definitely agree with that. And I actually want to take the conversation in another direction real quick. Now, as mentioned, we reviewed your resume, and I mean, it's very impressive. And a lot of times folks don't understand about the disproportionate impact of minorities in the juvenile justice system. And I know that some of your work has actually studied that. Would you mind sharing some of the findings that you came across?
Sure. So as I said, I'm a social developmental psychologist. So one of the things that I've done in my career is study teenagers. It was a lot of fun, especially having worked at a law firm, to go from that studying teenagers. One of the things that we find is that, for example, you can't just look at arrests or detentions or contact with the juvenile justice system if you're trying to ask the question of how often do people commit illegal acts, because that really doesn't get at. What we find is that with teenagers in particular, if you ask what we call like self-reported offending, if you ask people to just report on the types of illegal things that they've done, which could include things like smoking marijuana or cigarettes if you're a kid, all kinds of things, right? That on average, there really aren't very many racial and ethnic differences between white versus non-white groups. So again, that's self-reported offending. When you ask people to report on themselves, their behavior, you don't really see large racial and ethnic differences. On the other hand, as we all sort of know, what you do see are huge disproportionalities when it comes to the number of people who are actually entering the system with criminal records, essentially, for doing those same types of offenses. So there's a huge disconnect between people who are actually committing the acts and people who are actually being caught for those acts. Another, I think, common misconception or thing that people often don't understand is that we talk a lot about Black youth or Latinx youth, or actually some of the greatest disparities are among Native American youth, as far as that's concerned. Has to do with the idea that even though we talk about majority versus minority, it's still the case that we have a white majority, and therefore the largest number of people, particularly if we're talking about kids again, who are committing delinquent acts are white. But the reason we talk about Black youth or Latinx youth or other people is because, not because they're committing like an absolute majority of the crimes, but because they commit or are held accountable for a greater number of delinquent acts than you would expect given their numbers on the population. So for example, if you think about Black people being about 17% or 12% of the population, there may be like greater than 80% of the people who are in juvenile detention facilities right now who are Black. That's greatly outsized numbers given their numbers in the population. And so a lot of what we find is that there's gross disproportionality, and the disproportionality starts from the very first moment people have any sort of contact with the system, that is contact usually with the police. And then that sort of disproportionality continues as they move through the system. So at every stage in the juvenile justice system, we see greater disproportionality. What we have a harder time putting our finger on is the idea of disparity. And with disparity in particular, what we mean is if you take two similarly situated youth, one white and one Black, that they're going to be treated differently, or they're going to have different outcomes. Right. So that is harder to nail down just because there's so many different decisions, so many things that you that could result in the different outcomes that people have. But nevertheless, given just, even the visuals associated with, for example, who you see in detention, we do know that there's something there. So that's that's an issue that we're still trying to pin down and trying to understand more. But I think the bottom line is that disproportionality matters, just the fact that there are outside numbers matters, right? And so trying to address that can go a long way towards trying to deal with some of these other, like, for example, disparity related issues.
Right. So speaking of outcomes, I actually want to transition to Mandy and talk a little bit more about economic opportunity, because criminal justice in and of itself and trying to fix that alone won't fix a lot of issues that communities face. So I want to ask Mandy about some of the challenges that she has faced as a Black female founder, because research shows that venture capital funds goes to less than 1% of Black and Brown founders. Now, Kanarys was able to raise $575,000 in their first round of funding. So Mandy, would you explain a little bit about some of the issues that you've had to deal with as a Black female founder?
Yeah, so as you noted, there's huge disparities in not only the amount of capital that women are able to raise, but also founders of color. And so we recently, in November, finished another one of our funding rounds. And so we raised $1.5 million, which is great, but that puts us in the number of less than 50 Black women that have raised over $1 million, which is horrible, right? If you think of how many people have startups, how prevalent venture capital is, and the fact that there's less than 50 Black women that have made $1 million. So there's an organization called Project Diane. They run the studies on this, and so they're actually going to be releasing the new numbers in 2020. So we will get to see, and I'm hoping that numbers will be will show some even larger growth. When they first started collecting the data, there was only 2 years ago, there was only 17 individuals. It's actually, I'm sorry, this will be their third report. So they started collecting the data in 2016. And at that point, there were 17 Black women. What the research shows is that Black women in particular get 0.02% of venture funding. Their average amount of venture funding is around $42,000. And so when you think about, kind of economic opportunity, the ability to grow and scale a business, access to capital is key and critical. And so what we've seen through the research, just like, we're fighting to address the disparities that we see within corporate America, we ran into those same challenges as we start to set our business up. A lot of the research shows that women are asked different questions by VC firms, not just by men, but by women as well, right? Because we all have been socially indoctrinated with these kind of same biases and stereotypes, that women are asked more prevention related questions and men are asked more promotion related questions. So for example, men are asked more about the market opportunity and ways where the business will be successful, where women are asked more risk related questions and how they're going to address certain risks. And so if you're asking someone all risk and prevention related questions and leave the meeting thinking more negatively about the business than opportunity and promotion related questions. And so these are things that are very, very prevalent. Same thing, the way the VC community works. It works on warm introductions. It's very odd, but there's not a way typically where you can just cold email a VC or reach out to them. The way the system works is they want someone to vouch for you. And so when you look at the makeup of venture capital, it's like 70–80% all come from Harvard or Stanford. A large majority of them are all men. And so then just the nature of the way the system works is warm introductions are going to exclude so many people outside of those networks and those communities. So, similar to how there's been an emphasis given the deaths of George Floyd and the Black Lives Matter movement that we've seen over the coming weeks, a lot of venture capital firms have also pledged that they are going to make a commitment in Black founders. We will see. I think for everything, right, we will see what that means. Some of them have appointed separate funds now strictly for Black founders. That has been met with, hope, but also criticism, saying that Black founders should always be considered just like anyone else, who has talent. Why are we making a separate fund where you may have a, $100 million or, $500 million fund, but you've set aside $1 million or $2 million for Black founders? And so are we then pigeonholing them into a very small pool of that funding? But, I'm very encouraged by what I'm seeing. And, there's been a real, intentionality behind, we need to ensure that there are more diverse venture capitals. Because one of the things is it's hard to even analyze the opportunity if you're unfamiliar. So for example, a business like ours, when we first started talking with venture capitalists, we heard questions like, you really think people of color have a different experience in the workplace? It's like they couldn't even wrap their mind around the idea because they were so unfamiliar with the experiences that women or people of color or any other underrepresented or marginalized group goes through. And so there's been a lot of research that shows the long-term economic effects of not investing in these communities of color, because those communities are then solving issues of their communities, but also are more likely to hire members from their communities as well. And so it's an issue that has tremendous economic impact in our country.
Right, that's true.
Thank you for sharing, Mandy. That was really enlightening. There's so much about venture capitalism that I have no idea about. And just hearing it from like the equity and the equity perspective and a woman's perspective is amazing. So thank you. I'm gonna turn it over to Krystafer. Last but not least at all. So Krystafer, thank you for being here today. Cody and I looked at your interview, your resume as well, and you have done so much in education. You've been in so many different aspects and roles in education. So from in the classroom to actually, working with the state as well at state level. And so our question to you is, what role do educators and education play in creating communities where every child can have the opportunity to become an independent and thriving adult?
Yeah, so I'm going to be a little wonky for a minute and say that, so I sort of answer that twofold, I guess, right? Which is like, on the one hand, I really subscribe to this idea of like an ecological model that is posited by Brofenbrenner, that like teachers and education are part of a larger sphere of social networks and social sectors that uplift and bolster and support children and families in a variety of different ways. So on the one hand, I would offer that education is just sort of like one piece of a much larger puzzle that it also contains things like criminal justice and housing and public health and maternal health and all of these additional inputs. On the other hand, there's an enormous body of research that indicates that the teacher in front of a child, the teacher that is in a classroom with a student, is second to none, really, other than parents and or the building principal, in having a positive or negative outcome on that student's academic experience within a K-12 setting, but also their long-term returns. And so oftentimes when you're in a classroom role as an educator, it can feel as though a lot of pressure is placed upon you. But the reality is we have a lot of evidence that supports that teachers in particular and educators more broadly are one of the key levers that we have at changing outcomes for kids and for communities, really. So I don't think that the role of educators or education more broadly can be understated. But I do think that we have to be incredibly careful about the way that we think about the educational system. And as a nation, as Americans, I think we have a tendency to believe that it can be a panacea for so many things. And I think what we're seeing really over the past decade, and in particular what we're seeing in COVID, is that, you know, we've asked the educational system to do a lot. And we aren't always providing or equipping the individuals that are in roles to be able to meet the expectations that we have for the system. And so there's a little bit of a disconnect between the national narratives and myths that we tell ourselves about what education can do and the way in which we think about education in practice in classrooms and communities across the country, but also education as a policymaking or political exercise. You know, a very often quoted fact is like, you know, when you survey likely voters, one of the last things that brings a person to a poll is a candidate's position on educational issues, right? And when we think about school board elections, which are less common in the Northeast, but quite common in the South, those are some of the lowest turnout elections that we have, and are usually decided in the tens or hundreds of votes. And so I think, you know, education holds a lot of promise, but we have to reimagine and recommit ourselves to understanding more fully what that promise is exactly that we want education to fulfill, and figure out how to structure a system that meets the needs of our society, but also meets the promise of our kids.
Thank you, Krystafer. So I think what we're going to do is we had a few questions rolling on in. And so Amber, would you like to go ahead and share those out, or I'm able to?
Sure, I can go ahead and share. So the question was actually from Evelyn. And Evelyn, would you like to unmute yourself and just ask Mandy your question?
Yes, of course. Hello. Thank you so much for joining us, everyone. Like Amber said, my question was for Mandy. Could you provide some examples to help like, let's say people who are supervisors and such can, examples that we can do to help promote equity in our workplace?
Yeah, no, that's a great question. So I think what all of us, you know, as we were preparing for this panel, and I think one of the things we've shown through our discussion today is that we have to be intentional about creating equitable systems. I think within the workplace, what we've seen is that we will use kind of the existing structures and assume that they are a meritocracy or producing an equitable result. And so usually when we come in and work with organizations, we will really go through best practices with them and look at things like, what is your talent acquisition process set up like? We'll hear things like, well, you know, we're not actively recruiting at HBCUs or Hispanic serving institutions. We, you know, recruit based off of just who's in our network. So we know that those types of policies and structures produce inequitable results. We know even the way you put together a job description will change the applicant pool. So there's just lots of research that we really work with organizations on to say, we can't be methodical. I'm sorry, we have to be methodical. We have to be intentional about every single thing we're doing in our structures to ensure that we are producing those equitable results, because typically organizations will come to us and they'll say, we have a pipeline problem. And, you know, that's, I think, the go-to, because it's easier to say there aren't qualified, you know, they can't find these women or they can't find people of color. But then we start going through and actually working with them with their policies and their procedures. And we see that it's really the structures that they have in place that are producing these disparities within their organization. And so typically when we work with an organization, we'll ask them if they're measuring diversity, equity, inclusion, and they'll say yes. And then when we start drilling down, they're measuring diversity. They're saying we lost this many women within the workplace, we gained this many Latinx employees, and they're not doing anything to actually measure equity and inclusion. They're not surveying their employees on their everyday lived experiences. They're not doing any kind of analysis on pay equity. If they do it, it's like every 10 years. And so we have to do this type of regression analysis, not only on our pay practices, our promotion practices. We have to look at everything within the structure and make sure that they're not producing these disparities that we see. And so one of the things that we've seen a lot is that sometimes they're, you know, the way a lot of paid promotional or management leadership programs are put in place is that people will be shoulder tapped for them. So the way to ascend throughout the leadership of the company has kind of been predetermined by the leadership, and many kind of underrepresented groups weren't even aware of these programs, so they couldn't participate in them. So just things like that, like how are we sourcing to ensure that people that are being tapped for these positions and programs were really had the same kind of access and ability and knowledge of them to participate. In addition to the things I'm talking about, which are, you know, sometimes need to be led by HR, there's a lot of things that individuals can do just in speaking up, right? We see a lot of microaggressions in the workplace. On the Kanarys website, because although we help companies, one of the big things on the platform as well is providing transparency and accountability into a company's culture. And so you can go on and you can see in detail their benefits, their policies, their initiatives, the experience that other individuals have had in that workplace from a diversity, equity, inclusion perspective. And so on resources.kanarys.com, we have all kinds of materials on leading conversations on race in the workplace, allyship, other things that any employee can do to really help bridge the gap that we're seeing.
Thank you, Mandy. That was super informative. So how the rest of this time is going to play out is Cody and I are going to ask a general question in which any of four of our panelists can feel free to answer, can take turns. And then we're going to follow up with opening it up with the questions that are coming into the chat box. So we're going to try to go in order after that with the remaining time that we have, with also respecting everyone else's time. So if you have questions, please go ahead and submit them, but we'll begin with our general question. So our overall general question is, how do you imagine a stronger community? Specifically reflecting on the Terry commitment to give back, how can Terry scholars contribute to building healthy, thriving communities?
Anyone can answer the question. It's open.
I can jump in. I think my mind immediately goes to the fact that every single one of us, independent of what our job role is or what the sector that we're going to work in, we all have the ability to be a social justice leader, an equity leader. And there should be equity in every single sector of our society. And so I think just recognizing that is the first step. A lot of people are like, oh, but what is equity in my role? And there's always a place for equity. There's always questions you can ask yourself. How to Mandy's point, how are you creating policies and procedures? That's definitely one of the ways that I would immediately answer that question.
When I think back on my experience as a Terry Scholar, I think one of the things that being a Terry Scholar enabled me to do that I probably wouldn't have had the opportunity to do otherwise was to do something like study abroad. So I studied abroad in Mexico, and then I also studied abroad in Spain. And sort of what I've learned from that experience, especially since I ended up going to college in a place that was 2.3 miles away from my parents' house, right, was like the idea about it's so important to put yourself in positions that are scary to you or that are completely outside of your own experience to make yourself uncomfortable. And I feel like being a Terry Scholar is kind of what enabled me to do that. And I have continually done that in my life. So like when I went to Columbia for law school, I had never been north of Maryland. When I moved to New York City, I had never been on a subway before. I remember, in fact, I think one of the first times I'd really been up in a skyscraper was to go to the Terry interview to meet Mr. and Mrs. Terry. And so all that to say that I think a lot of our sort of communication issues and a lot of our kind of not understanding and not being able to empathize and take the perspective of another person is not having practice in taking purposefully making ourselves uncomfortable and and seeking those experiences that are outside of ourselves and trying to learn from other people. And I think that that's one thing that we as Terry Scholars can make a commitment of, if nothing else, particularly in the short term and in this next year.
Did anyone else want to add any tips or respond? Well, I see we have a question from Gabby in the chat. So Gabby, would you be interested in asking your question directly, or do you want me to answer it? I mean, ask it for you.
I can ask it. You can hear me, right?
Perfect. We can hear you.
So this is a question for all panelists. Having dedicated your lives to studying structural inequities, how do you deal with the seemingly large percentage of people in our country that deny or choose to be willingly ignorant to the existence, prevalence, and influence of structural inequities? Is there an optimal way to display factual or undeniable information to these persons?
Were the panelists able to hear the question? Because Gabby, you were kind of going in and out. Were you all able to hear it? Good?
Yes,
okay.
Yeah.
I was able to hear her, yeah. So, you know, what I've seen, you know, is that there's been a lot of people wanting to lean in and learn more, right? I think for the first time that I've seen in a long time, people are willing to acknowledge, hey, maybe I kind of call people the matrix. You know, you lived your life one way and then you take the pill and then you're able to see everything. That people are realizing that people's lived experiences are very different, and you know, they've been able to see things that they haven't been able to see. And so, you know, there's lots of books that people can read. You know, again, I you know, on that, resources at Kanarys on things on how do I be a better ally. We have tons of books, movies, different things that people can take advantage of. But I think usually when you're able to help people with some of the self-learning, because I do think it's hard to just give a couple of scenarios, right? People really have to dive in deep. This isn't easy work. It takes commitment. But once you start reading the history, right, of the way these structures were set up, that's why we have to be intentional, because the structures were set up to be inequitable. So if we're using pre-existing structures and think, well, even though there's no discriminatory intent in it, right? We say, well, this is just the way it's always been. Well, when it was originally created, it was created with a discriminatory intent. And so even though that intentionality may not be there, it's still producing these disproportionate effects. And so one of the things that I like to give people, and some of them are sold out now, are books like Lies My Teacher Told Me, right? There's all kinds of different things that you can read to really learn about the history of our country, the structural barriers that were put in place, and the longstanding effects they still have on our society today.
I want to echo and like elevate and affirm what Mandy shared. And I also just want to, like, one way that I try to think about it a lot is like the inequity that we see is inequity by design. Like, these things are not accidental. And so when we think about policy solutions, we have to design policy solutions that by design disrupt and reconstruct a new frame. And Gabby, you asked a question about, is there an optimal way to display factual or undeniable information? And I really want to throw that to our social psychologists on the panel. So I'll just say quickly, like what I have experienced in my time doing work with big data and also trying to help people understand that while poverty is part of the challenge of education, or health determinants are part of the challenge of education, we also have an inequitable educational system by design, is that data, quantitative data, really can only take you so far. And what you need is a story. You need a face. And so you use that quantitative data, those percentages or those descriptive statistics to help people understand the universality of a particular story. Because it's harder for people to refute one particular person's lived experience. And it also draws on our own shared humanity, at least in my experiences, both in sort of like bureaucratic organizations, as well as in more advocacy-oriented spaces.
Yeah, and I would say for the past few weeks, so I love statistics. I really like quantitative psychology, and I think Krystafer's exactly right. Like that's really only part of the story. But I work with people with PhDs pretty much every day. I work with people who, who identify as lifelong learners, who even study psychology, who still don't get it. And so that kind of in some ways has me thinking, okay, so what is the issue there? And I think it's really interesting, again, that you kind of framed it in terms of, well, what are the ways in which we can communicate with them in order to get them to get it? And I think that's it. My experience has been that sometimes that's the way in which you communicate it is just not the issue, right? Like it's you could say it in a million different ways. You could present a million different charts, and you could even have the best stories, and some people will never hear you. And so I think part of the reason why, especially recently, what I've been thinking about is more why that is. And I think in thinking about that, and this is anecdotal, not necessarily based on my research or anything, the idea that people feel really threatened, right? Like the idea that what does it mean if I've been living my entire life for, 20, 30, 40, 50, plus years, and I'm just now figuring out the things that I thought were wrong, right? Like to admit and to be vulnerable and to acknowledge the things that you have ignored or the things that you thought were okay is not a small thing, but also people kind of need to get over it, right? Like that's kind of what I mean. Like you need to get comfortable with being uncomfortable, because that's how people who are marginalized feel a lot of the time, right? Like that you need and I can't help but kind of relate this in some ways to my experience, like I said, going to New York, because there were a million things that I had never seen before, and it just had to be okay for me to be ignorant, right? Like I can't do better until I know better, and I have to acknowledge the things that I don't know in order to be able to even gain the knowledge that I need in order to be able to exist in a way that I feel is appropriate, right? But I feel like we're living at a time where people feel that it's not okay to admit that the things that they don't know. And if you can't get past that, then I don't know how much further we can get past in terms of, like I said, the data or all of those things are really important, but it's just not enough to kind of get us there. It also has to be some level of acknowledgement of growth and the potential for growth before we can be able to have an actual dialogue. Because that's not really what we're just saying. Like we don't want to talk at people. We want to engage people and have them be able to grow from the experiences that we share.
Thank you, Tammi. Lifelong learners, that's what I'm hearing. Lifelong learners and continuing to learn and change.
Yeah.
Really appreciate that. So we are going to jump over to Bilad's question. And Bilad, do you want to read that out for us, or would you like for me to read it out?
Oh, sure, I can read it out. Hi. So I was wondering, well, thank y'all so much for joining the panel. It's been really, really good. And I think a question that I have for, like, specifically for panelists like Tiffany and Kayla who are involved in public health equity, I'm wondering, like, what are some ways, if you know, that, like, I or other students who are passionate about health equity can become involved, like, in health equity during undergrad? if we hope to pursue that field as in the future as like researchers or physician researchers or in public health. And if y'all know of any opportunities, either like nationally or like in Texas. So.
Yeah, it's a good question. I wish I did know some resources. I will say I didn't even know roles like this existed when I was an undergrad. So there's that. So I don't have a specific example of what you could get involved with. I'll definitely do some research and see if I can find some. But one thing I would always push people toward is, as Mandy said earlier, like recognize and research the history of medicine, and be critical of how it's operating today, but also be critical of yourself and, you know, have opportunities where you can do your own self-reflection and learning and recognize, you know, implicit bias is a thing and all those kind of things. So definitely push that within your own social circles, within med school or whatever, you know, you're doing. But I think it definitely starts there. And I think pushing for education and equity education in all aspects of healthcare. Tiffany, do you know of any opportunities?
Yeah, so honestly, something that I've learned is that everything is a public health opportunity, everything. And until we look at it that way, we can't help and fully like solve illness going on too, right? Illness, COVID-19 as a virus, racism as a virus. So I think my advice to you is whatever you're interested in, follow that first, right? So something that I was interested in was really nutrition and looking at nutrition as a way to really look at health and health justice. So I followed that path, and I'd volunteer at the WIC clinic. I'd reach out to any type of like a food bank, and then just kind of network and really look at it again. You'll find often that leaders sometimes don't really have the health equity lens. And I would say more so in Texas and in the South than in many regions, especially compared to the Northeast. So you can be that voice and you can really look at like, okay, how can we really reach populations that haven't been fully reached? One of them for me is the Latinx population. Is there Spanish accessibility to what's being offered? Sometimes that is a connection that can really help us to push to health. So that's just my my quick advice. Feel free to connect because I could go on and on.
Yeah.
Cody, I think, yeah, go ahead.
Yeah, so thanks a lot for the question, Pilar. And I see in the chat that there are other questions and certain folks are asking specific panelists for advice. So we promise that we will make sure everyone has an opportunity to reach out to them individually. But we're coming up on our time and we don't want to keep folks too long because some folks may need to go make dinner and some folks may just want to go to sleep. So I'll kick it off to Amber so she can make her closing remarks. But thanks a lot, everyone, for tuning in, and a special thanks to the panelists for agreeing, because whenever we reached out to each one of them, they readily agreed to join. So thank you all for giving back to the Terry Foundation and continuing to be a part of a great organization.
Thank you, everybody.
I just wanted to echo that gratitude and also to acknowledge that this is a discussion that you could easily have over the span of multiple meetings. So obviously we've just scratched the surface, and I think that there have been some very intelligent questions and statements made in the chat. So we'll make sure that we share the chat transcript as well as tonight's recording via email, and then also on Terry Connect, so that everyone can go back and review some of the things that were discussed. But ultimately, you know, if anyone in the Terry community is interested in having a deeper dive conversation in any one of these areas specifically, that's obviously something that we can do more of, because we have Terrys across the country that are in all of these respective fields doing this kind of work. So we wanted this to be sort of a broad overview conversation, but it can't and should not stop here, because there is obviously a lot of work to do. And I just want to express my gratitude on behalf of the foundation for the way that everyone in this group is honoring their commitment to give back by using their education and using their strengths to turn around and make an impact on the world around them, which is so important. And another thing that's important to acknowledge, and a few people shared some examples when they registered for this session, is there's not just one way, as we've seen, to make an impact. There are lots of large and small things you can do, whether that's like one of the examples was creating a little league program for underserved children in the community, all the way up to tackling some of the big disparities that exist within education or healthcare systems. So there's plenty that you can do, and this community is one resource that you can really tap into, both to find inspiration, but also to find guidance using things like Terry Connect, attending and participating in panels like this. And like I said, we could talk about this forever, but I know that we've already, gotten a good start. And again, panel, thank you so much for spending your time with us this evening, in addition to the time you put into preparing to participate. I really want to thank Tiffany and Cody for taking the initiative to put this together, to get their questions together, and really help frame this conversation. I want to thank everybody who has participated in the chat and who joined this evening. This is easily a conversation that can be carried over to Terry Connect, either in the messaging or in the feed itself. As I said, I will be sharing the recording for tonight as well, so that y'all can all look forward to that. But panel, if anybody has to jump off immediately, that's completely understandable. If you have a second to look over some questions, feel free to stay too, but we want to be respectful of everyone's time, definitely, especially those of you on the East Coast for whom it's a bit later than it is here in Texas. So once again, y'all, thank you so much for joining. I'm going to go ahead and stop the recording now. So we'll give everyone just a couple of minutes. If you have anything else you want to put into the chat, feel free. But excellent job, everybody. I really just enjoyed the discussion tonight.